You may pass very dark or even black menstrual blood. How worried should you be when that happens? In this video, let's look at some of the causes of passing black blood during your menstrual periods. There may be some cases when it's a natural event, but here I also share a few causes where something might be going wrong. Menstrual blood or the vaginal bleeding during a woman's menstrual period is typically red. However, you may find different grades of red, pink, brown, or even black during your period. These may be from your normal blood flow or indicate some serious medical conditions. Light red or pink blood may happen during the early part or towards the end of your period. That is just about when the bleeding is about to start getting into progressive flow or when it's tailing off. Light red or pink blood may also be what you see just after having a baby, which is also known as low care. Now, as you get into the later part of your period, it is rich blood red, and sometimes as it passes out of the vagina and mixes with air, it may turn a little bit darker or look brown. Brownish blood may also suggest an infection within the womb, but when you get extremely dark or black blood, here are a few possible causes. First, we'll break them down into the normal causes and then when there are abnormal reasons. The first normal or natural reason you can have for period blood to appear black has to do with the menstrual flow rate. If the blood flow is slow as it happens towards the beginning and the end of the period, the blood can get darker simply because it is pulled for a period of time in the womb before it comes out from the vagina. As it happens for most of us, the period flow is usually a slow start that builds up to a more rapid rate after the first day or so of the period and continues that way for a few days. The heavy flow then gradually slows down as you approach the end of your period. The other thing that can happen in the context of a normal situation is that simply as some of the blood emerges and mixes with the air, it becomes oxidized, which makes it look dark or black. This is similar, for example, to what happens when you cut a piece of fruit like an apple or an avocado and leave it exposed to the air. It starts to look darker after a while. Oxygen mixes with blood in a natural reaction called oxidation, and this explains many times why your period blood looks darker than usual or black. In addition, black period blood may be a feature of some menstrual products, particularly tampons. Now, this does not mean that tampons cause you to have black period blood, but the way the blood appears on the tampon gives the impression of looking darker. So, blood that is absorbed onto the tampon gets oxidized slower than that which is not. And so when you withdraw the tampon, you perceive blood that looks much darker than usual. Secondly, menstrual blood sometimes contains clots. These are small fleshy bits of tissue made of congealed blood. Now, this is natural and often harmless in small amounts, but it can appear darker than the rest of the menstrual blood when it is absorbed by the tampon. So while the tampons themselves don't cause the blood to change color, the way the blood interacts with the tampon and the fact that they may absorb and isolate clots can make the blood on the tampon look darker than what it actually is. So these are normal reasons you may experience dark or black blood during your menstrual period. It shouldn't be in large quantities usually, and there are no other associated features like pain or other irregularities. Now, what about when there is an abnormal process happening? Yes, a few conditions could lead to expelling black blood during your menstrual periods. And the first is from hormone imbalance. Hormone balance is important for regulating the menstrual cycle. Usually, the womb lining thickens at the beginning of a cycle as it prepares for a possible pregnancy. If you don't get pregnant in that cycle, your hormone levels drop, leading to shedding menstrual blood. However, suppose there is hormone imbalance. For example, what happens in conditions like polycystic ovary syndrome, PCOS, or some thyroid conditions. In that case, the timing of your menstrual flow and its intensity can be affected. If the hormone changes make the womb lining shed more slowly, it can lead to the appearance of black menstrual blood because it's had more time to oxidize. Next are conditions like fibroids or endometriosis. Fibroids are non-cancerous or benign growths in the womb, while endometriosis involves tissue which is similar to that found in the womb lining growing outside the womb. Both of these conditions can cause heavier and more prolonged menstrual bleeding. As we've mentioned already, when blood flows slowly or it pools in the womb as a result of these conditions, it can oxidize over time. And this oxidation process can make the menstrual blood appear very dark or black. Infection within the reproductive tract is another reason for experiencing dark menstrual bleeding. So these can be infections, often sexually transmitted, within the womb, within the cervix, or pelvic inflammatory disease, which lead to abnormal vaginal discharge and irregular bleeding, including passing dark or black blood. Therefore, experiencing symptoms of infection such as pelvic pain, a smelly or offensive period or vaginal discharge, fever, and other signs of being ill can indicate these types of infection. Next, we have some drugs or medicines that could affect the appearance of your menstrual blood. One good example is anticoagulants or blood thinners. These drugs treat conditions like blood clots or DVT or abnormal heart rhythms like atrial fibrillation. Blood thinners reduce the ability of the blood to clot. Normally, when you have a cut or during menstruation, your body typically releases controlled amounts of natural substances known as clotting factors to help control bleeding and clotting, which is when the blood goes from liquid to solid matter. But these clotting factors may not function as effectively if you're taking blood thinners. What does it mean for menstruation? Well, it may mean a longer period before some of the blood emerges from the womb. This allows it to become darker or even black. So the slower flow of menstrual blood can result in a change to its color. And the final condition we're looking at in today's video that may be associated with passing what looks like black or dark blood is with or following a miscarriage or other pregnancy complication. With a miscarriage, for instance, there is vaginal bleeding. But in addition to blood, fetal tissue may also come away from the womb. As all this can happen at different flow rates. You might have a mixture of fresh red, dark brown or black blood as the blood and tissue break down and become oxidized. You can see why monitoring changes in your period blood is important. For the majority of us, experiencing a little bit of dark or black period blood in small quantities from time to time can be as a result of some of those reasons I mentioned at the beginning. However, suppose it's associated with features of an infection, signs of hormone imbalance, or happens in large prolonged amounts, or you consistently experience very dark or black menstrual blood. In that case, seeing your doctor to identify the cause and get the right treatment is essential. So let me know if there are other situations where you may have experienced black period blood that I've not mentioned in my list. And if you found this video helpful, please give it a like and consider sharing with a friend. If you'd like to discuss specific concerns about your health, please use our email health information service. The link is here and I'll add it onto the description box as well. Check out these other videos on abnormal vaginal bleeding also on the channel, links in the description box. Thank you so much for watching and I'll see you again soon.